Like my home country Germany, Great Britain only pays mediocre wages in nursing. And this means that many nurses from abroad move on after a short time to countries that pay much higher wages. And 3 are particularly attractive. For years, medical nurses from abroad have been an important pillar of the British National Health Service, the NHS. But not all of these nurses stay in the country permanently, especially after Brexit. And emigration is increasing rapidly, especially into states with significantly higher salaries. In the 2022-23 fiscal year, 12,400 nurses applied for the necessary documents to prove their qualifications abroad. That was more than twice as many as in the previous year and a quadruple increase compared to 2018-19, the last full year before the pandemic. And the increase was most noticeable among nurses who were trained abroad and who have worked in Great Britain for a maximum of 3 years. This suggests that Britain is becoming a stepping stone for a growing number of foreign nurses to move on to other destinations, write the authors of the Health Foundation think tank in a recent study. It is striking that 4 out of 5 applications come from 3 countries. That's Australia, New Zealand, and the United States. Nursing staff there are paid significantly better than in Great Britain. The NHS enjoys very high approval in the country, or enjoyed it until some time in the tax-financed health system was considered a great achievement once. But austerity policies as a result of the financial crisis, an aging society and a high proportion of overweight people have taken their toll on the system in recent years, and what the country did after Brexit and the staff shortages. Added to this were the significant demands on medical staff during the pandemic, and many people have to wait months for treatment appointments. For years, many positions for doctors, but especially nursing staff, have been difficult to fill. The NHS has therefore increasingly relied on recruiting from abroad outside the EU. Medical workers have simplified visa requirements and lower salary thresholds than many other professions that need visas. It almost looks like the NHS is slipping down the rankings as the most popular location for international nurses, was said by Anne-Marie Rafferty, Professor of Nursing at King's College London, and she told this to The Guardian. And she said, "What is particularly worrying is that when it comes to pay, Great Britain is no longer seen as a high-wage country, but only as a middle-level provider and as a stopover in which foreign nurses get used to the Western healthcare system and then go in search of better pay conditions." But Britain is indeed not alone in its worries. In many Western industrialized nations, there is a shortage of skilled workers in numerous areas of healthcare. Demographic change is likely to make the situation significantly worse in the coming years. Germany has also been actively recruiting medical nursing staff abroad for several years now. This approach has long been a tradition in Great Britain, and the proportion of nursing staff trained abroad is therefore high. According to OECD data, it was already at 18% in 2021, which is higher than in other countries in Western Europe. Of the newly registered nurses in the country in 22-23, 24,000 had completed their training abroad. Almost half of all new recruits, according to data from the industry watchdog Nursing and Midwifery Council. But widespread bottlenecks in many countries mean that competition between individual countries is increasing. Working conditions and pay are becoming increasingly important, as the British data seems to show. The basis is the Certificate of Current Professional Status, or CCPS, which is necessary to prove employment in Great Britain when applying in other countries. In the 3 most popular destination countries, nurses earn significantly better than in Great Britain, as I said. Adjusted for purchasing power parity, the average annual salary on the island is the equivalent of $46,000 US, according to the latest OECD data. In New Zealand, it is 57,000, in Australia it's 71,000, and in the USA it's 84,900. And for comparison, according to the Federal Employment Agency, healthcare professionals in Germany earn an average of 3,928 euros a month, which corresponds to at least 47,000 euros per year. The three most popular destinations have recently announced measures to attract more medical nursing staff from abroad. Changing is also made easier thanks to the English language. Almost half of applicants to the US were trained in India before coming to the UK, and another fifth in the Philippines. Both countries are characterized by good English skills. In principle, most nurses come into the country from there. In 22-23, it was almost 80%. Great Britain does not only perform poorly in international comparison when it comes to pay. Care workers have also seen few wage increases in recent years. In nominal terms, salaries improved by 9% from 2010 to 2020. In Germany, it was 21%. And the bottom line is that there was a real loss of 6% for nursing staff during this period in Britain. The past 3 years have further exacerbated the situation due to high inflation. Many unfilled positions also lead to a significant workload. Various groups of NHS workers have been going on strike for months as well, and there are currently no work stoppages planned in the nursing sector, but the industry's major unions continue to threaten strikes if working conditions and pay do not improve. Employees obviously have the right to work in countries where their skills and knowledge are particularly valued, said Pat Cullen, General Secretary of the Royal College of Nursing Union. But this is becoming a big problem for the country as the need of patients can no longer be met. The National Health Service, the NHS in the UK, has faced significant funding challenges under the Tory rule since 2010. Following the global financial crisis of 2008, the Conservative-led government implemented austerity measures I mentioned earlier aimed at reducing public spending to tackle the budget deficit. And this led to constraints on NHS funding as well. Despite increasing demand and inflationary pressures, NHS funding has not kept pace with the growing needs of the population. Budgets were effectively flatlined, meaning they remained relatively stagnant even as demand for healthcare services continued to rise. In real terms, NHS funding has been cut or has failed to keep up with inflation, resulting in a reduction in resources available for healthcare services in the country. And this has led to challenges in maintaining staffing levels, upgrading facilities, and investing in new technologies and treatments. The population of the UK has been growing, and there has been a significant increase in the number of elderly people requiring healthcare services. The demographic shift, combined with the effects of austerity and Brexit and funding constraints, has placed additional strains on the NHS. And some critics argue that under Tory rule, there has been a trend towards privatization and outsourcing of NHS services. While the NHS remains predominantly publicly funded and provided, there has been an increase in contracts awarded to private companies for healthcare services, raising concerns about the long-term sustainability and integrity of the NHS. The underfunding of social care services, which are closely linked to healthcare provision, has also had a knock-on effect on the NHS. Displays in discharging patients from hospitals due to inadequate social care provision have contributed to bed shortages and increased pressure on NHS resources. Funding constraints have led to longer waiting times for routine treatments and surgeries, as well as delays in accessing specialist services. And this has resulted in patients experiencing prolonged periods of ill health and reduced quality of life while waiting for necessary treatments. Overall, the decline in NHS funding under Tory rule since 2010 has contributed to significant challenges in providing high-quality, timely healthcare services to the UK population. Despite government pledges to increase NHS funding in recent years, many argue that it has not been sufficient to address the backlog of underinvestment and meet the growing demands on the healthcare system. And in this video, I put a little of comparison with Germany for a reason, because demographics is happening almost everywhere. But the British did us a little favor here because of Brexit. It's a lot of nurses from the EU have left Britain to find a job inside the EU, and made it easier for German hospitals to find staff, even despite we also have shortages, but not in the same amount as in Britain. And we got a little bit of help because of Brexit. So there are some positive sides of Brexit, just not for the UK. And if you want to know more, the next video is right here in the end screen. I'll see you there. I'll be back.